Hello, everybody. I'm Dr. Nancy Tarlow, and I'm thrilled to have Dr. Miller on today to talk about differences in whether, a right side of the brain or a left side of the brain is weaker, I guess is the way we're describing it. I first met Dr. Miller about 4 or 5 years ago at a conference. He was a speaker. I was blown away by his talk, and I always kept in the back of my mind that you were somebody that I wanted to connect with. And we first spoke 2.5 years ago. I wanted to talk to you about somebody near and dear to me who was having some major anxiety issues as well as other things. And in 5 minutes, you nailed what the problem was. Like I still am blown away to this day how I told you like 3 or 4 things about her, and you're like, oh, she also have X, Y, and Z? And I said, yes. And unfortunately, we waited to bring her to your clinic. We should have come a year and a half ago when we first talked. But anyway, we just came back from Tampa, and I was just not only blown away by the work you did with her and myself, but just watching you with your other patients in the clinic and, your demeanor, your gentle way that you work with them, your knowledge, and just seeing people kind of shift a little bit even during that week. So anyway, thank you very much for coming on today and sharing your wealth of information.
Well, thank you for all the kind words. Yeah, so just to kind of share the audience back a little bit about my background. I graduated from Logan University, Health Sciences in 1980, January 1980. And so I've been in practice, active practice, for 44 years. Certified in acupuncture, became certified as a naturopathic physician, uh, kind of a lifelong learner, certified in functional medicine. I started looking in the brain in 2015 because I was having some memory problems. And so I was investigating all the different things, that cause problems with our brain, what we can do to help our brain. And I wrote a book that became an Amazon bestseller, Saving Your Brain. And it was really for the aging brain. And it was probably 2020 when I made a big transition where we went to children. And so I still see right now I've got a 2-year-old and I've got an 88-year-old and everything in between. So what we do, the same principles we use works at any age, and it works on really any kind of, if we look at any kind of academic behavior, psychological or mental health challenge, this approach seems to work beautifully with all that. And it's just something that we developed over time. I trained at the Carrick Institute over in Cape Canaveral, and I also trained with Robert Melillo, who's author of Disconnected Kids, Reconnected Kids, a textbook on autism. He's just got his PhD. He's been basically I think he published 12 different research papers that pretty much substantiated everything he taught in his book. So good friends with him, talk to him regularly, but we have a clinic. And so what we're talking about, the commonalities with all these, no matter what kind of, whether it's anxiety or depression or schizophrenia or bipolar or ADHD or autism or oppositionally defiant or OCD, that they have two commonalities. And one is that they all have retained primitive reflexes. And I'll just talk a little bit about what primitive reflexes are. They develop in utero, and they're to help facilitate the birthing process and movement in early life. And there are things like, if you've been a mom, like if you are nursing a child, if you touch their cheek, they'll open their mouth to try to latch on. If you put your finger in a baby's hand, they'll grab it. If you make a big noise, they stick their arms out. That's called the startle reflex. But there's about 10 of these major reflexes, but they should go away after the first year of life. And if they don't, it indicates that an area called the brainstem, which is at the base of the brain, didn't mature properly. And the significance of that is multiple. One is the brainstem is the brain like a foundation is to a house. And the three primary sensory systems that develop the brain and grow the brain and keep our brain healthy, quite frankly, as we age, are the balanced postural system. And then we have the vestibular system, which is a coordination between our eyes and ears. Where are we in space, anytime? And then we have what's called our oculomotor system, which is our eye tracking. So being able to fixate on an area or watch a train go by, or a saccade movement, like if we're in traffic, we're looking left, we're looking right. And if that isn't working, we can't judge the speed of that car and the distance. And from a practical standpoint, if our saccade function isn't working, we have problem reading. That's really one of the most common problems we see with reading speed and reading comprehension in people of all ages. And that is, again, controlled by different areas of the brainstem or the cerebellum or the parietal or the frontal cortex. So that's the commonality that we have. And the other thing's significance, huge significance with having primitive reflexes is that they integrate into the brainstem, and that's where the vagus nerve comes from. Okay. And the vagus nerve goes to every organ in the body, and it controls the parasympathetic nervous system, and is also known as the rest and digest, but it's the calming, it's the down regulating, it's the healing part. You have to have parasympathetic influence to secrete hydrochloric acid, to produce pancreatic enzymes, to produce bile from the gallbladder. You have to have parasympathetic influence to not make your gut leak, have permeability. So a lot of things, immune system, it's involved in all kinds of things. But this imbalance in the brainstem sets a precedent that there becomes an asymmetrical growth of the brain. So we're all born right brain in the beginning, and about age 3, we flip over to the left brain. Okay, and that's about the time that our hippocampus matures. And now then we get memories from like a movie, okay? We remember hearing things, remember seeing things. That's the average age. It can vary a little bit, but before that, we just have impressions, so when there can be lots of bad things. We could be in a bad living situation when we're young, but we don't remember it, but we have feelings about it. So there's something called ACEs, which is a questionnaire for that, and if that happens, it really impacts, the quality of life and longevity. But so if we come on too soon, the right brain doesn't develop, okay? So the left brain. So sometimes these kids, let's say, ADHD kid or autistic kid could be, they're geniuses. They're super smart. They get really verbal. They're doing all these things super early, okay? They're walked too early. They talked really early, but their right brain didn't develop. And the right brain is a social brain. And the right brain is, looking at reading voice intonations and facial intonations and body language, and its filter. And the other, thing we talk about, the vagus nerve, is that vagus nerve goes over to the right basal ganglion, and that's our filter. Okay, that's the should I or shouldn't I say or do that. But it's also the ability to stay focused, and if there's a little extraneous audio or visual input, that I can still stay focused on the task. So that's a really common problem in right brain deficit. We have that because you have the impulsivity lots of times, and it's a lack of maturity in the system. So on the other hand, we can have a delay. And the other extreme of a right brain dominant is their superpower is they're incredibly empathetic. They can read people incredibly well. They feel what other people feel. But too much, it can be a detriment. From their side, they also are super sensitive about what other people perceive of them. See, that's their kryptonite. Okay, so that's kind of the extreme from one way or the other, and a right and left brain. But we're going to just kind of look at some of these things here. So if we look at the brain, it's interesting. I think about all my education, all the things I did, and I took neuroanatomy, in school way back when, but nobody ever said that there was a difference between the left and right hemisphere, you know? And there's a huge difference. It's like two different brains, but they're supposed to coordinate and synchronize. And I should have put a slide in here of the Brodmann areas, but there's actually 52 different distinct areas on each side of the brain called Brodmann areas, and it's a yin-yang relationship. They do the same function, but in a opposing or coordinating fashion. And so what happens if we get too strong in one area, then it's suppressed on the other area, then we have specific problems. So like if we have a Brodmann 6, which is like right above our sideburn, this is the biggest motor area in the brain. If we have a super left strong brain, then we could have a tic, okay, because we're motor, because we have all these stereotypical behaviors are stored in what's called our basal ganglion, okay? So if I want to brush my nose, I want to pull my ear, I want to put my hair back, I want to put my arm up or whatever, the left brain is the direct drive and it initiates this activity, but the right brain is supposed to follow right behind and turn all this off. Okay, I won't get into that's a good enough explanation for what happens, but I won't go through all the neural, it goes through the thalamus and it goes through the putamen and goes through the caudate or all this other stuff that people don't know what those words are, but it can be either an activity or it can be a thought, depending on what area it goes to the basal gland. So that's how those people have these ruminating thoughts. Like you ever get a song in your head and you can't get it out? Well, that's what echolalia is. You heard of echolalia? That's when kids, autistic, they just it's kind of like Pete and repeat. They say things over and over again. They have this, they thought, whatever that goes in their thought, there's no filter, and they're just going to go say it. And they say it, and they say it, and they say it. And lots of times the kid is starting to get hysterical because he doesn't want to say it, but he can't stop. But that's because the right brain's not turning it off. But again, we look at left brain, there's so many different things, like our left brain, number one emotion for the left brain is anger. Okay. Number two emotion is happy. Okay. So, if you get a super left brain dominant person and weak right brain, they're basically angry most of the time. They're happy when they get whatever they want, but as soon as they don't get what they want, they're very angry. And if you have an immature right brain, socially, then that child, young adult, is acting very immature. Okay. They're 10 years old, but they're acting like a 5-year-old. They're 15 years old, but they're acting like a 7 or 8, they're having temper tantrums. They're doing this. They don't know. They can't socially adapt. The right brain is empathy, sympathy, regret, embarrassment, all these things. I once had a little kid who was 10 years old. He pooped his pants. He didn't care. He'd care less. Okay. Until he became aware, his right brain came where he became aware. And then he didn't want to do that anymore. So hundreds of different functions like this on the left and right brain. The left brain activates our immune system. The right brain suppresses our immune system. Okay. There's even certain neurotransmitters that are more from the left brain and certain ones from the right brain. There's certain immune cytokines and things from different parts of the brain. But here's just kind of some major symptoms if we look at this. So this is if someone who has high left symptoms, okay? They're obsessive compulsive. So the left brain is detail. You get an autistic kid who'll walk in a room, he'll see like a penny at the far end of the room, or he'll see something, they'll walk right over there and pick it up. Okay. Most of them wouldn't pick it up there. The extreme of that is obsessive, but they like regimen. The left brain likes routine, likes the same thing. So when we're treating right brain deficit kids, like if we do therapy, we do the therapy the same way, the same routine. This is first, this is second, this is third, because that's kind of how they expect it. And it's less problems. Impulsive, addictive behavior, tics, vocal tics, mania, outbursts, overly concerned about detail. I was a left brain, and like when I was worked, and I had 22 employees at one time, and I was always concerned. I was way over concerned about some little detail instead of the big picture on really, we're seeing 60, 80 patients a day, and we're doing awesome, all this stuff. I'd get always worked up about some little something. So people can do it. They have an overactive immune system. They're going to be sensitive to smells, touch, allergies. They're going to have blood pressure problems. They're going to get increased cortisol because they have more fight flight. Okay. Can't sleep. They're anxious. These are very common. So if we look at this, we look at if we look at anxiousness, oh my God. They say in college students, 1 in 3 students has an anxiety diagnosis in today's world. That's scary. But anxiety is a very concomitant diagnosis with ADHD. And there's many different kinds of ADHD. You can just have a attention or a focus problem where you can you can be the ants in your pants kid, it's hyperactive, hypervigilant, all over the place all the time. So that's high left. And then we'll talk about some of the conditions. And then here's low right. Okay, 80% focus attention is in the right brain. So sustained focus attention is usually a function of the right brain. For nonverbal communication, okay, again, we're talking about voice or facial expressions and body language, not picking up on these things. This is the big picture. Many times they're reading. They can read all the words. But what do the words mean? What's going on in the story? Many times low right brain have problems with balance and spatial skills. However, there are some very elite athletes. That's not 100% true because there's a lot of the dumb jock, so to speak, kind of myth. It's not that. It's just they have problems with certain learning aspects. Probably one of the things, can't control eye movements, like someone that can't look in your eyes. They're always, looking away, looking over here, looking. Lacks motivation and persistence. Right brain deficit kids, if they aren't great at something right off the bat, they don't want to do it. Especially if they're in a competitive arena, when they look at someone else, like they go try to do something and they see some other kid that makes them look bad, they won't do it again. It's really hard to get those kids. Team sports are really tough. You're much better trying to get them into, bodybuilding or do something initially till they get some things. So one of the things when we talk about muscle movement, the left brain is a little fine motor control. Okay. So you just think about all the gadgets they have, we're looking at all these gadgets. They're driving the left brain. Right brain, big muscles. Climbing trees, riding bikes, push-ups, sit-ups. When I was a kid, we were up from sun up, sundown. That was it. We were riding outside. We're playing games. We're playing hide and seek, going through creeks and climbing trees, all kinds of stuff. So if you have a child who's, in the ADHD or in the spectrum, the more you can get them to get in touch with their body and use those big muscles, the better. So here's some more things with the low right. They can't decrease their cortisol. They can't decrease their blood sugar. So again, can inhibit or lower their blood pressure. So, I have a lot of adults that if you think about hypertension and diabetes as a side effect of autonomic or of a brain imbalance over many years. They have tachycardia. If you look at all these things that people go to the emergency room for, they have chronic health degrees, blood pressure and blood sugar. So poor reading comprehension, poor math reasoning, poor gross motor skills, generally lower body tone. However, there are exceptions to that. That's not 100%. Like I said, they can have I know some really good athletes that are right brain deficit. Oftentimes they have a head tilt to right. It's like if you see an autistic kid, it's very common that they have their head tilted to the right. Poor eye tracking, poor smell. Okay, so like autistic kids, really, a lot of them have smell problems and they have behavior problems. So interesting, the area of the brain that controls our behavior, the orbital part, is the same area that controls our smell. So really a way for like these kids, if you work on that, we get your spice kits out. If you have a child who's a little in that spectrum, is really work on cinnamon, clove, coffee, chocolate, smell, make a game out of it. Okay, what is this? What is this? Because they can't smell, they're going to be a picky eater. Okay. So I like wine. So if you like wine, try holding your nose and drinking wine. Okay. Can't taste it. So it's 90% of our food is our smell. What do we in there? So again, we work with that. That's a good thing with the kids autistic is trying to work on their smell. You can get essential oils. You can get a bunch. You can get lemon. You can get orange. You can get peppermint, things like that. But what we do, so here's some of the just related disorders. So if we kind of look at the extreme of a left brain dominant could be a schizophrenia. That's probably the worst. Probably the worst of a right brain deficit. It could be bipolar, for people that, that's kind of the worst end result, people wind up but most people are depression. That's usually a left brain deficit. So there's some commonalities, pretty much Alzheimer's, I'd say 90% is left brain deficit. So we have right brain deficit would be ADHD, autism, OCD, ODD, anxiety many times, left brain, dyslexia. Okay, that's a biggie. Left brain. Dyslexia is probably the most common of all neurodevelopmental problems, and it has nothing to do with intelligence. It just has to do with that their brain isn't coordinating that eye tracking. And lots of times when we have them read, we have a computerized methodology, something called the right eye, and it'll measure each eye. And they're either reading the same thing over and again, or they're like skipping down a line, or there's missing words. So they're just missing. And also they get confused like B's and D's and P's and Q's. And so it has to do with there's eye, and it seems to be related to light in some way, because if we change with the transparency, we'll put it over the reading material, you know, like with a yellow or an orange or a different color, you experiment with it, they can actually read better and faster. So it's something, so there's definitely a relation to the, you know, you get a white page in black, but that's very hard for them to interpret that information. And when we look at all these things, we have something called functional MRI now. And so when they look at all these people that have these names and maladies, we actually see a difference in those networks between the left and right brain. And there's usually in the cerebellum, the thalamus, the basal ganglia, and the frontal cortex. There's a difference. There's a size difference. You know, they may have a 6-lane highway over here and they got a dirt road over here. So fortunately, the brain is neuroplastic. So if you do specific sensory motor activities, and when I say sensory motor, what do I mean? That means something with visual, something with auditory, something with tactile, that I'm doing that and I'm doing a reaction because that's how we grow, through sensory motor activities. That's how our brain grows. And so if we do that specifically, and we co-activate that with things like vibration, light, sound, laser, electrical stimulation, simultaneously to the weaker side, and we have them do that activity, it creates a neuroplastic change. So we can beef up that network. And they do it enough. Those symptoms, as soon as there's more parity between the two left and right side, those symptoms starts falling away. Okay, they're going to get better. Sometimes they go away altogether. I have children that have been declassified from ADHD and autism or Asperger's all the time, or dyslexic. It just takes, you know, most of these cases of dyslexia and ADHD in probably 8 months. We see a kid a couple times a week. They're usually in pretty good shape. That's not 100% for everybody. It can be varied, but usually it takes that long to get the primitive reflexes integrated and get all those 3 sensory systems on board because they're immature. Because what we're talking about is because there was a lack of maturation in one system, it caused a multiple domino effect of a lack of maturation in other networks. And so if we do an analysis of those networks, then we can find where the weaknesses are. And they're still going to have their strengths, but that's, you know, we don't succeed on or I guess we don't fail on our strengths, but many times we can fail on our weaknesses. So especially in academic, just the way it is, when children have reading speed and reading comprehension, then that's holding them back, you know, from doing things. So what we do, we look from the bottom up. So we're looking at the brainstem, we're looking at the cerebellum, we look at occipital region, we look at the temporal regions, parietal regions, we look at the frontal cortex. We do quantitative evaluation of those. We determine which is the weaker hemisphere, and then we start, I call it getting armored up. We armor them up. We're going to put a lot of sensory information on one side of the body. Everything is opposite except smell. Smell is on the same side of the brain. So that's how we fix it. So this is just contact information.
So I wanted to, share my personal experience. So, when we came there, my focus was on the person I brought with me. I really didn't think I was going to be doing any work myself, but I watched the evaluation that you did and, the plan and working with all these tools that you have. And I'm like, sign me up. I want to do this too. And it was interesting because one of the things you had to do was, I think it was called right eye tracking.
Right.
Um, and, for me, I didn't realize I had a problem, but God, that was so hard to follow the thing I had to follow with my eyes. I didn't realize I even had a problem, probably because I don't read that much anymore. I used to be an avid reader. And then the metronome, how hard that was. But I caught on pretty quickly. I think by the third day, like I was doing really well. But I also love the fact that because I was coming from Pennsylvania and you're down in Florida, we could do like double the sessions. We did, a few hours, then we took lunch and we came back. And I, I'm curious if you find that doing that, like, do people get too fatigued, or do you just find that they just really get much better results by doing that, those kind of intensives?
Well, it varies between the individual, and their age and their lots of different factors. But um, some people could only do once a day, but a lot of people can do 3 a day. So really, if they're higher functioning, um, a lot of people come to Florida, but they come make a vacation out of it. So we'll see them like 9 to 12 in the morning. Then they got all afternoon to go to Busch Gardens or Adventure Island or go to the beach or go to the zoo or, you know, so they can do a combination of things.
Yeah, we
But
were there to work.
right now I've got a young lady that we're doing 4.5 hours a day. So she's doing 3 in the morning, comes lunch, comes back. Um, and then tomorrow we're starting with a 10-year-old brother and a 3-year-old sister, and probably the 3-year-old we're just going to see once a day because that's, you know,
Right, right,
you can't
because
do
they're
a whole
pushing.
lot. You can't do a whole lot with a 3-year-old. Like we can't test them on the right eye, and we can't do them this. So it's all physical. We're going to work on our perimeter reflexes. We're going to work on core strength, and we're going to work on timing. It's interesting. I do neurofeedback too, but I have a 2-year-old that we're doing neurofeedback on, and it works great. I only have one patient that can't do neurofeedback. It's an nonverbal autistic, and he's just so hyper vigilant, like he's going to pull off the clips or, in 2 or 3 minutes. But most people, most of the other kids can do it.
So I have a question for you, going through your presentation, like I always thought of like OCD and ruminating thoughts to be someone who was like more stuck in beta. Like I always associate that they're in this fight or flight mode and they can't turn their brain off because they're just in this survival mode. So you actually take it one step further and talk about specific areas of the brain that are having an issue.
Yeah, it can be both. And people with high beta can be like that, if people have a lot of beta, that's like their subconscious is just chattering all the time. And, I liken it to, okay, they're in a foxhole and they got a machine gunner on them all the time. And there's a helicopter running around with a light trying to locate them. And they got a mortar fire, they got all this stuff going on all the time. And usually it's negative. And they're just constantly thinking these things. And lots of those people have trouble sleeping because they can't shut off their brain at night.
That was me for a long time,
But you can
for
have both. I
30
mean,
years.
but what we do is from a neurofeedback point, we'll do those specific things. So, there's a lot of research on neurofeedback, 50, 60 years. So someone has depression, we're going to do, the classic points here at F3, F4, and we're going to do beta on this side and alpha on this side. If we have an ADHD kid, we're going to do CZ, and depending on their age, we'll do different frequencies. And but we're going to do the hemispheric. We're going to work on the primitive reflexes and do the hemispheric uh, as well. So I mean, we just pull as many tools that we can coordinate and synchronize that will work well together to try to change the brain as fast as we can.
So the other thing is the first 2 days, I was there like 5 hours a day, like working hard. And the first 2 days, like I came back to the hotel room and crashed. I was so exhausted. I was so
We
drained.
probably
But
slept better.
Yeah, I think I slept, I slept about the same,
Passed out.
but by the third day, I felt like my brain was awake. Like I felt like it had been sleeping. And of course, you had said that, I had like high delta brain and, so a lot of people who may not understand what that is, I guess it means I'm sleeping all day or.
Well, there's a brain. So when we look at brain waves, there's a developmental, that's another, but we we look at 5 different brain waves, and as we age, our brainwave activity gets faster. So like when we're little babies from 0 to 2, we have primarily delta waves, but we sleep like 20 hours a day. So we don't need a lot of brain power. When we get 2 to 6, we develop, and so delta waves are like 1 to 4 hertz cycles per second. And then from 2 to 6, we develop theta waves. So that's faster, 5 to 8 hertz. Then 6 to 10, we develop alpha waves. So now we're 8 to 12 hertz. So around age 10, we should have a frequency of alpha about 10 hertz. And that should become permanent if we're normal neurodevelopmental for our adult life. And that's like our idle speed of our brain. And 10 hertz is the frequency. We have 5 hertz, 10 hertz, and 40 hertz between the frontal cortex and certain areas of the brain, the brainstem, cerebellum, or the limbic system, 10 hertz, and then 40 hertz is the thalamic loop, thalamus. And so depending on with the brain waves, so we're looking at that, and then beta wave, 10 years old, we develop beta waves, and beta waves go up to 40, and then above 40 is gamma waves. But when we look at a child, we can look at the brainwave activity, or an adult, and we can see a lack of maturity through the brainwaves. Okay, so delta, too much delta, not enough alpha theta is a sign of immaturity. Now, it can also be high delta, can also be an environmental. It could be mold, it could be Lyme, it could be heavy metals, it could be severe food sensitivities as well. So we look at some of those things too. But lots of times, just when we get rid of the primitive reflexes, I've done a whole series on that the delta waves go away and the higher waves come up, just getting rid of the primitive reflexes. So the brain is maturing.
So do you have courses online that people can like dive deep into this? Like maybe chiropractors or other types of professionals that want to work with,
Well, we're
adults
kind
or
of putting
children.
something together. It's called Saving Your Brain University. And I have a lot of my videos on there. I've got over 100, 110, 120 videos. So we're slowly adding that, but a lot of them are webinars. So we have little bits and pieces like we have where you can learn how to do primitive reflexes. You can learn how to do a cerebellar function test, different basic things that you would do to learn how to test a brain, or more just learn more about how the brain works and how, for yourself, for someone close to you that you want to use some different tools, add some tools to your arsenal.
Yeah, I see this astronomical rise in dementia, Alzheimer's, and of course autism, like all these neurodegenerative diseases are, just increasing, and we need people like you who can work with these demographics, with these populations, because, people are frustrated and they need help. So anyway, I want to thank you. I'm going to turn the recording off in a second so we can open it up for questions. But I want to thank you. I learn so much every time I'm in your presence. So I'm really grateful to you and appreciate you and looking forward
Well,
to.
when you get 69, you just get a lot full of stuff. Some people call it something else, but you accumulate stuff
Yeah.
between your ears.
Yep. All right. So thank you so